Okay, we're right at 5:30, so I'd like to kick things off here. Thank you for those who joined us here online, and thank for those who are going to view this video of our talent talk. So, for those who do not know what talent talks are, there is an opportunity to shine for our departments to speak about what they do on a daily basis and show all the great things that they do within their department. So, tonight's department that we're going to overview is our Pediatric Emergency Department, and I got the great team here with me tonight that'll talk more in depth of what they do. So we'll get things started here. So first off, we like to start with if you have any questions. You guys are muted in the presentation, so if you please ask the questions via the chat, we'd be glad to answer that. Also, if you'd like to join us tonight via camera, we'd love to see your faces, not just only us, but you as well. So we would definitely enjoy that, but no, pressure whatsoever if you wanted to keep that off as well. So wanted to do a brief introduction of myself. My name is Robert Swicka. I am a nurse recruiter. It'll be going on about 5 years now. I recruit the adult ICUs and most of the emergency departments here at Atrium Health, Wake Forest Baptist. And provided is my work cell and my email. Also, the little QR code there. That is my LinkedIn. I really love highlighting the amazing things that Atrium Health Wake Forest Baptist does on a daily basis, weekly basis. We do a lot of great things. So if you want to give me a follow or find out more information, scan that QR code and give me a follow. Be glad to follow you back as well and share any information that we have going on within our organization. So just to start things off, a little background about Atrium Health Wake Forest Baptist. This gives you a very high level overview on what we do as a whole organization. So just give you a snapshot, we have about 21,000 teammates, and that is gradually increasing as we're expanding our footprint in different cities throughout the state and through the Midwest. Currently, we have 7 hospitals locally that's under the Atrium Health Wake Forest umbrella. Now, urgent care wise, we have opened up the 2 additional, so we're now at 13. Our emergency departments, we do have 6, but our adult ED is getting a brand new ED that's opening up next week and will gradually be fully operational as the year goes on. Our cancer center locations, we're really high emphasis on the medical field of cancer research, and we do really emphasize that as an organization. And just to give you a snapshot of our net revenue, 4.3 billion. That's only going to increase in the next few years as we open up a few more surgery centers, and we'll expand again throughout the state of North Carolina. So it gives you a little 24-hour overview of what we see on a day-to-day basis. About 12,000 patients, 175 surgeries, 13 babies delivered, physician visits, which we're also going to do virtual visits, which I'm sure will increase that. Emergency department visits, that time of year and stuff. So that's why we really loved, to highlight our PZD tonight and show them, show you guys what they do. And we are an academic medical center with our medical school that's being built in Charlotte. So we're really diving into on that part and really broadening our strength and strengthening our physician practices. So just want to give you this little snapshot of what we do here at Atrium Wake. Locations. I like to speak. I like to give little highlights of these locations. North Wilkesboro is Wilkes. Basically in the mountains. So if you're like rural area, that's a great spot to be. NASCAR and stuff, great place for if you want to catch some NASCAR excitement. That's a great place to go. High Point is basically the furniture capital of the world. And that's probably our second largest hospital in there. So really cool buildings and great vibes in that area. Winston-Salem is obviously the mothership. It definitely has its own zip code. It has 885 beds. So definitely a great spot. Lexington Medical Center, barbecue capital of the state. Also, I would have to say they probably have the top cafeteria out of all 5 hospitals. I'm sorry, Winston, but that's just my thoughts. Bermuda Run aka the Country Club Davie Medical Center. Great spot, great, nice location, very warm, welcoming people. So just a overview of our 5 hospitals. And what's really nice is all 5 hospitals really work together as one. I know a lot of people know about Western Carolina and the effects on that in Wilkesboro. I mean, our teams across all markets came together and helped out with North Wilkesboro. So we really appreciate working together as one and love all our market locations that we have for Wake. So I'm going to hand it off to my Pediatric Emergency Department leadership team and have them do a little brief introduction, and they are going to take over these next few slides. So I'll let Michelle kick it off.
Hey, good afternoon, or I guess good evening. My name is Michelle Daniels, and I am the nurse manager of Brenner Children's Emergency Department. And I'm so very pleased that you're joining us tonight. I could not be more proud of the organization that we all work for and the department that we serve with our community. I'm also very fortunate to work with an amazing crew of leaders that you're going to meet tonight. I'll just kind of go in order and they'll talk more later. But we have Alicia Zimmerman. Alicia has a great deal of years of experience in emergency department, and just you guys hear these words. Alicia works weekends. We have a weekend leader. She's there on Friday, Saturday, and Sunday, and she is a quality guru. She loves to do all things quality and audits and documentation, and she's just amazing. Kelsey Becker, the next person on your lineup, she is our clinical educator. Not only is she the clinical educator for our pediatric emergency department, but she also works very closely with our nursing professional development specialist and nursing education to provide you in a robust orientation throughout the time that you come in as a new graduate or a new employee. She also has been a nurse in our emergency department for several years, and we're just very proud of all the work that she does. Last but certainly not least is Lara Lamont. She is our assistant nurse manager for evenings and nights. She has been born and bred in our emergency department. She started very early in her career, a new graduate nurse with us, has worked her way up from staff nurse, charge nurse, and now assistant nurse manager, and very proud of all the operational work that she does and just assisting the team. We'll go into it just a little bit later about the department. Would just like to tell you that I myself have been at Wake Forest Baptist Health for 32 years. I started as a nursing assistant, became a staff nurse and a step-down ICU in the adult hospital, and then very fortunately moved on to the emergency department in 2000 and have been there ever since. I was a staff nurse, a charge nurse, assistant nurse manager, and now I'm very blessed to say that I'm the nurse manager of this amazing program. I'm going to let Kelsey Becker get started next with a few slides, and then we'll all kind of intersperse and talk about the department and the great things that we do.
Thanks, Michelle. So like Michelle said, a little bit about me. I have been a nurse for 14 years. About 12 of those years I have spent back and forth in and out of the pediatric emergency department. I always wanted to work in the emergency department, and then the opportunity came to be able to do the pediatric emergency department. I was basically taught how to be a nurse in the pediatric emergency department. I have left several times to explore other avenues of nursing, but I always come back to the PZD. The PZD is really home to me. And Michelle's an excellent manager, and I absolutely love being a part of her leadership team. I've been in this clinical educator role for about 2 years now. I actually left a management role to step into this role. So why the PZD? Why would you want to come work with us? Well, first and foremost, we are a level 1 trauma center for pediatrics. And let me repeat that. We are a level 1 trauma center for pediatrics. That is hard to find. And, for staff, particularly emergency staff or emergency medicine staff that loves trauma, our trauma junkie nurses out there, this is a great place to work. And it's just extra special to be able to take care of kids in those situations. We have a very diverse patient population. We care for kids through every stage of their life. We see anywhere from infants up until 18 years of age. and we do take care of some younger adult patients too, if they're still followed by pediatrics. These patients usually have complex medical history. We've got 30 different pediatric specialties. Some of the ones that we see most commonly in the Pediatric Emergency Department are going to be hematology, oncology, orthopedics, trauma, and surgery. If you are a nurse that likes to use critical thinking and problem solving skills, this is a great spot for you. I don't think there's one single day that you will go without working in the emergency department that you won't use some form of critical thinking or problem solving. If you also like skills and you like to keep your skills up and you like to have a large skill set, the emergency department is a great spot from, starting IVs to catheterizing patients to accessing ports to taking care of traumas. You use your skills regularly. The PZD is also a great place for teamwork and collaboration. I do feel like we have a very family-like atmosphere. We all come together and work really well together. Along with working well together as a team, we work well with multidisciplinary teams as well to provide the best care to our patients. There's lots of consultations that come down to the emergency department. We are a teaching hospital, so we have students, medical students, we have residents, we have fellows, we have a little bit of everybody is kind of what it feels like. And we work very closely with all of those different staff members to care for our patients. There's also lots of opportunities for professional growth and learning. We've got a clinical nurse pathway, which basically allows you to use your college degree, whether it be an associate's, bachelor's, or master's level. And it also encourages you to get a national certification. All in while you're doing that, it makes you eligible for monetary incentive, anywhere from 5% up to 15%. We also encourage our staff to get nationally certified. I can proudly say we are almost at 50% for our nursing staff having national certification, which is really impressive as a unit. We also have great committees, which Alicia will talk about a little bit more. But we've got a Sunshine Committee and then professional governance. The Sunshine Committee is like a morale boosting committee, and then professional governance allows our nursing staff to be able to speak up and take care of issues that are going on in the unit. And then there's always opportunities for PI project involvement. We've done lots of PI projects throughout the past couple of years. One of the big things we're working on now is our J-tips. We're trying to get J-tips in the department to help with our IV starts to make them less painful for kids. And then one of the things I'm really proud of that I really enjoy is our trauma simulations and our training boot camps. We've got a trauma boot camp, and then we've got an ED specific boot camp. And our trauma simulations are something we typically run quarterly. It's just a great opportunity for everybody to come together, practice our skills, and then sorry, that's my child screaming in the background. Practice our skills and then be able to communicate with each other and kind of come together and really collaborate as a group between nursing and the physicians and trauma. So those are a few of the reasons. There's many more. I think I'm going to turn it over to Alicia next.
I think it's me. Sorry, Kelsey.
Oh, sorry. Sorry, Lyra.
It's fine. Hey guys, I'm Lyra. Michelle kind of discussed how long I've been in the department, but I basically started here as a new grad and haven't left ever since. I kind of just found my niche. These are my people. I can't really imagine working anywhere else. Thought about it and never been able to do it. I love the group that I work with and just everything about the department, from trauma to everything else. They've really grown me into the person I am and the nurse I am. And I really couldn't imagine working anywhere else or with any other people. Just a little bit about our unit. We have a 24-bed unit. We have 8 ancillary beds, which include our hallway beds and our express intake area, which is an area that we run with a nurse and a nurse practitioner or physician assistant. Those are where we see lower acuity patients and try to just really work through some of the lobby if we have one, and kind of just turn and burn patients with those APPs out there. We are proud to say that we try to keep a 4-to-1 ratio as much as possible. We do have one assignment that can be 5-to-1, but other than that, we pride ourselves on keeping that 4-to-1 ratio. And then we, again, have management coverage on days, evenings, and weekends. I myself work evenings. Alicia's there on the weekends, and Michelle and Kelsey are there on days. But we, as a group, work to cover any shortages often. we're not really stuck to one shift. Michelle comes in at 3:30 in the morning. I stay until 5 in the morning. Alicia too. Kelsey's been there to 3 in the morning just this week. So we will not leave our team short or in the weeds. If they're in the trenches, we're going to be right there beside them. We like to say our motto is work hard, but have fun doing it. And you can kind of see that in our pictures there. And I'm going to turn it over to Michelle.
Let me get off mute. So one of the things that I love to do is celebrate our team. And as you can see from these pictures, what a team we have, right? All these bright smiles. It just makes me so happy. But we have had multitudes of Nurse Excellence winners. And what Nurse Excellence is, it's a program within our organization that we recognize amazing nurses who do wonderful things. We have a ceremony for them, Nurses Week, and provide them a nice plaque and some lovely special gifts and just recognize them and give them honor. We also have, as they stated, 24, but I believe we might have gone up to 26 certified nurses. The national certifications, and I'll show a slide on that later, but you go anywhere from certified emergency nurse, certified pediatric nurse, certified pediatric emergency nurse, trauma emergency nurse, and a multitude of others. As Kelsey stated, we have 9 CNCP enrolled nurses. And just as Kelsey told you, not only are these recognized and given professional distinction, but they are also given a monetary incentive to get these certifications. Again, anywhere from 5, 10, or 15% of your pay. It does increase once you go through this program. And as long as you maintain your certifications and your requirements for this program, you maintain that 15% if you have the requirements for that. We had 2 Nursing Star recipients. Nursing Stars are recognized by our organization for exceptional nurses. And when I say organization, I don't just mean Wake Forest Baptist Health, Atrium, Levine Children's. I mean all of Advocate Health. Advocate Health is the top 5 to 10% of hospitals worldwide. So we do a great job with that. We also have had a Daisy Award winner, and that's in your top right, and that is Tiara Davis, and we're so proud of her. She just has the best personality. She will often orient staff, so if you were to join our team, I am certain that you would see her. We'll go to the next slide. As I was speaking of, this is our wall of fame. This is nationally certified nurses. These are the names that we put up on a board that's right outside of my office. And we actually, again, like I said, we've added 2 since then, and a multitude of certifications. We also have a program. It is a sexual assault nurse examiner and forensic nurse program that is under the umbrella of Brenner Children's. And some of our certified nurses are those kind of people as well. One more. There we go. Another thing that I'm exceptionally proud of is that we have overall at least an average of 11 years of experience. Now, that ranges from 6 months to 32 years. So we have nurses that join us all the time. In May, we have 4 brand new graduate nurses we're super proud of. They'll be joining us, and they graduate in May, and then they start in July. Our program, and we'll go over that a little bit more also, is 6 months in length for our new graduate nurses and 12 weeks of orientation for our experienced nurses. But as you can see, we value a very diverse population. It's not just the new graduates that come to our program, because we understand that everybody needs a little help. If you look in the picture below, we have Corey and Sheila and Julia. Corey has 8 years of experience. Sheila has 30 years of experience, and I actually am proud to say that she and I started nursing school together 30 years ago. And then Julia Duncan has got 5 years. So quite the diverse population and lots of experience for you to lean into if you were to join our department.
All right, so this is the part that I am the most proud of, some of our onboarding highlights, because this is what I spend a lot of time doing, and a lot of what I put my heart into for this department. So for our new graduate nurses, like Michelle mentioned, we have an amazing new grad academy. Our new grad academy is specific to the emergency department. It is combined pediatrics and adult. But basically, it's a 6-month orientation. During that 6-month orientation, you are in class for 24 weeks of that. You basically work 2 12-hour shifts on the unit, and then each week you go to class for 8 hours. And then you have assignments and things that you work on at home. Sorry. Along with going to class, when you're on the unit, you have a one-on-one preceptor. That preceptor is your mentor, your guide, your person. They show you the ropes and they show you the ways of the emergency department. A lot of times our new grads start on day shift and then generally transition to night shift, but it kind of depends on what the department need is when you start in that new grad role. And then during the new grad academy, you also earn 4 different certifications. You earn your PALS certification, your ACLS, your TNCC, and your ENPC. We also put you through trauma boot camp during the new grad academy, and trauma boot camp is a great opportunity for you to be able to put your hands on the equipment, figure out how our trauma equipment works. We talk about our trauma process, we talk about trauma documentation, and we actually run a trauma simulation. And then when you're in the new grad academy and you're coming to class, each week we discuss different things. One week, for instance, we might talk about neuro patients, and we discuss stroke symptoms and how you would take care of a stroke patient. After we discuss the material in class, we actually go to our sim lab and then we put it to practice. So we would practice how to take care of that stroke patient, how to run a stroke scale on that person. So it gives you some real hands-on practice before you're actually out on the unit doing it. And then I like to do weekly and bi-weekly check-ins with the new grads just to make sure that you feel good about where you're at, your preceptor feels good about where you're at, you guys are on the same page, and it just it gives me the feedback that I need to make sure that you're getting what you need. And then for our experienced nurses, it's a 6 to 12 week orientation. It's kind of dependent on how much or how little you need. During your orientation time, you do go to ED boot camp. It's a 3-day emergency care academy, ED specific skills and topics that we discuss in that boot camp. And then we also put you through trauma boot camp again, just like we do with the new grads, because a lot of people have never seen some of that trauma equipment or been in traumas before. You are also paired one-on-one with the preceptor. And again, I do a weekly or a bi-weekly check-in with you to make sure that you and your preceptor are comfortable with where you're at and how you're progressing, and if there's anything that I can do for you to make your orientation better. So I'm going to turn it over to Alicia now, and she's going to talk about committees.
Hey guys, good evening. So my name is Alicia Zimmerman, and Michelle already kind of stroked my ego earlier talking about my experience, but I'll talk about it a little bit more. So I've been a nurse for 10 years altogether, and I am emergency medicine born and bred. I love everything about it. Before I came to Wake Forest Baptist, I didn't feel like I really fit in completely and was happy where I was. So I came here to expand my knowledge in pediatrics and absolutely fell in love. This unit is my family. I love everything about it. And I really love the Atrium Health Wake Forest Baptist family and everything that they offer for you. And I've really been able to find my spot and grow from staff nurse to charge nurse into the assistant nurse manager role here. They give you opportunities to grow in every area that you're interested in. Everything that I've ever brought forward that I was interested in, they have given me opportunities to grow and learn in that area. So it's a very good place to learn and grow in any place that you want to go. One of my passions in emergency medicine and nursing in general is kind of burnout and making sure that we take care of ourselves as well. So I'm going to talk a little bit about our unit-based committees. A couple of our unit-based committees are very morale-centered because we want to make sure that we are taking care of our nurses so that our nurses are at their best and can take care of our little patients whenever they come in. So our first committee is a Sunshine Committee. It's a fairly new committee that we created, and its sole purpose is staff morale. We want to make sure that everything that they do is giving back to the nurses in the department, like I said, so that they can shine and be at their brightest. Some of the things that they do, you can see down in the picture, is a little snack cart. So they help fund and fill that snack cart, and it is just there for the nurses during their shift whenever they get hungry or they just need a little pick-me-up, like some candy or something. They can take from that, and the money that they get from that goes right back to the Sunshine Committee to keep giving back to our nurses. Some of the other things that they do, Nurses Week, they are instrumental in helping us celebrate our nurses. So they provided meals on the last Nurses Week and some things like that. They've also done a clothing drive for the unit so that when patients come in that are traumas or other situations, we, or like a vomiting incident, we have clothes that we can give the family so that that child isn't unclothed when they leave the department. They have something that they can go out in that's warm and comfortable and makes them feel good as they're leaving. And they also do lots of other unit displays of recognition or just fun things. They have some bulletin boards that are very interactive that they change frequently so the staff can interact. I think right now they're working on like a baby picture matching so that, the staff can look at the baby pictures and try to guess who that picture belongs to. Just things when you're in the break room or around the unit, it's a little pick-me-up while you're working. The next group that we're going to talk about is shared governance, and lots of places talk about shared governance, and they have a shared governance. We are building ours right now. We have a committee chair and co-chair, and that is Nicholas and Haley, and they are very bright and innovative and working towards helping the department. Shared governance really gives you the ability as a staff nurse to bring concerns and thoughts and ideas forward so that we can work on making the unit better. They have monthly meetings that are days long. They start at 8 in the morning, and I think they last into the afternoon, where they come together as an organization and they break off in different committees and talk about different things and share their ideas, their experiences, and all the things that they're doing on the different units. Let's see. And the next one is the social media committee. That one is brand new and something that we're working on. Again, is to build unit morale and kind of showcase all the good things that we're doing on the units. We've got different ideas from all of our different staff members, from the nursing assistants into the nurses and the providers, coming together to take our unit projects and the staff members, the different awards that we're winning, all the things that we're doing. We're going to take that together into pictures and, post that so everyone can see all the great things that we're doing and all the work that we put into our units. And this will also help with some of our recruitment efforts as well, which this video is also doing. And that takes us on to the next one.
All right. This is one of our teammates, Jillian, who was unfortunately unable to join us tonight, but she was able to help us with giving us a little testimony. So Jillian actually moved here. So we are very excited to have her as part of our team. She brought with her 8 years of emergency medicine experience, 4 years of that in the adult ED, and 3 years of that was in the PTD. And just a little bit of what Jillian says about our department. When this is just her little testimony, when we decided to move to North Carolina, my husband asked me where I wanted to work. My response was immediately Brenner's ED. I not only heard wonderful things about the care received at Brenner's from local community, but also through my own research and saw the retention of experienced nurses within the department on both days and night shift. Since working there, I've witnessed the teamwork firsthand, not just when a critical patient comes in, but in the little things that help the department flow. The team does not just stop with patients. It comes full force for personnel too. New babies, marriages, moves, degrees, and the like all get celebrated by the staff in one way or another. I was nervous about moving to an entirely different state with no family, but my husband by my side, and since our move, I've gained an entire family within the department. I love helping kids find the bright spot in their time in the emergency department to show them that it may be scary, but everyone is here to help them. And that was Jillian's little testimony.
Thanks, ladies. Appreciate your guys' hard work putting that all together. Very informative overview of what you guys do on a day-to-day basis. Applaud y'all for going through that. So as a great segue, what comes with a great team comes great benefits. So I'll talk about this slide tonight. So we do offer day one health insurance. I know a lot of companies, they do the 30-day waiting period, not Atrium Health Wake. We're available day one of employment. So like when your start date comes around, you have 30 days to make that selections. You're covered day one. It just takes a few weeks to get your card, but you are covered. We do have med costs for our insurance. If you ever want to take a look at their website, they're locally based, so just give them a look for their insurance. Competitive pay wise, I feel like we've made strides basically every other year due to competitors and also cost of living. So we definitely make initiative to be the utmost important to look at RN pay. So we do look at that on adjustment basis by every other year, and we're now in the mid 30s full without shift diff. So just so it gives you a little snapshot of that. Currently, just to give you a snapshot of the sign-on bonus, new grads do not get the sign-on bonus. It is more for experience, and experience is hard to come by. But for experience at the moment, it's $15,000. That gets paid out over a 2-year span. It is a recruitment incentive, not a contract. So just want to give you a heads up on that for that. Relocation stipends, we do offer that, and we do what's called a relocation gross up. So whatever the amount you get, it's like we pay you a little bit more to help you move to the area. So when it's taxed, it's like almost paying you that full amount. So do know that we offer relo as well. Retirement purposes, we're a nonprofit. So we have a plan called the 403B, and we use Transamerica for our retirement plans. And they do offer one-on-one meetings with reps from that company. And we do also match up to 7%. So up to 7%, we do match 6, but to get to that 7, we do have to meet our metrics each year. And they give us a 1% match of our base salary and make a deposit into our account at the beginning of a new year, which usually goes in around March or April. So potential 7%. Since we are a teaching hospital, we emphasize continuing education reimbursement, and that would start 6 months after your start date. So for a bachelor's degree, it's up to 50%, up to $2,500 per calendar year, and we do reimburse for books at $12 per credit hour. Master's degree goes up to $5,000, and that $12 per credit hour does pertain to that as well. Parental leave is up to 6 weeks paid. We do enhance that basically every other year as well and take a look at that more in depthly and make changes. So as we make changes, we'll definitely inform you of that. PTO, we do start accruing from day one. You should see for a 36-hour shift, you should see close to about 7 hours every 2 weeks starting out, but you can earn up to 200 hours per year to start. And then once you hit year 5, it goes to 240. And then at year 10, which is the max, it goes to 280. Just new this year, we do have a cash out option. So if you ever go above your PTO balance, there is a cash out option to give you yourself like a little bonus, but you do have to claim that on your taxes for a later date. So just a heads up as a disclosure. We do have live well incentives that come with our benefits. So it's like little tasks that you participate throughout the calendar year. I think it's like 4 you have to do. As you do them, they do pay out quarterly. So the 2 types of plans we offer is an HSA, a health savings account where you put money into, and the other is the copay account where you pay money up front. You get a card from Bank of America, and you would use that card for any medical expense. And then you would just provide them a receipt, and it will take care of any medical bill that you have within that calendar year. Now, the HSA is use it or lose it, but the copay does follow you to the next year on that card. We do have employer paid and certification costs from the ANCC, so you just inquire about that. And we do offer discounts on schools. I do have a list of schools for you, but the top 3 that offer the highest discount for continuing education is Liberty University, Chamberlain University, and American Sentinel. All 3 average around a 15% tuition reduction if you enroll as an employee with us. Now, what also is not on here is we do have an employee discount page, and we utilize what's called PerkSpot. PerkSpot, I mean, you can you can call it extreme couponing if you like, but man, it has many discounts as an employee, for an employee, like childcare, clothing lines, groceries, all that fun travel packages. I mean, it's a great source to save you additional money as an employee working for us. So currently, what we have available at the moment, we are seeking experienced staff nurses, and we do have nights available, and we also have night weekends. Our night weekends, it's called a weekend program, so it definitely has a shift differential worth exploring, and it is much needed. So these are the department needs at this time. Just to let you know about our new grad cohort, we did fill up for the May cohort, and we average around 2 to 4 new grads each year or each semester. So just want to let you know of like that avenue, because I know new grads are like really anxious and really want to get into the PZD, and it's highly competitive. And I know we go through a screening process and select the best candidates. But for the next cohort, which will be in February of 26, we'll probably have opening or opportunity for applications probably past the summer, like August, September, around there for the next wave. Just so you want to keep a lookout for an opportunity if you are a new grad reviewing this call. All right, so I'm back to having the questions. Anybody have any questions for this team tonight? We'd be glad to, answer them for you here, or if you want to reach out to us. I know we had that brief snapshot of the leadership, but they also have LinkedIn. So on that QR code under their names, you can view their pages, reach out to them via LinkedIn or per email. If you don't have any questions today, and here they are, their little QR codes. Also, what's great about it, since their social media, initiative, they will be posting all the great things that they're doing on, milestones, things that they're doing. So keep in touch with them on their pages and see all the great things that they're doing within the PZD. And then here's a little QR code. It gives you a little information to fill out if you like. And then I would follow up with you with any additional questions if you don't have any after this call or meeting, sorry. So I'll ask a question for the group. I like to break the ice for this team. So, ladies, I know new grads are very really wanting to get into the PZD. What if they do not get into the ED? What's the advice you would give a new grad to get experience? What you're looking for? Give them advice on what avenue that they would need to take to get to the PZD, or what you're looking for out of a candidate.
So I'll take that one. And I saw that Julia Foster asked a question. Looks like you'll be graduating December. Congratulations. What a feat to graduate nursing school, right? All the days and nights and all the endless sleepless nights that you spend studying. So we will have a cohort then. So just send us through these QR codes your email so we can get in touch with you. I will tell you that there have been a couple of folks who've had a shadowing experience. If you get in touch with Kelsey Becker, she can help you do that. There's a few things that you have to do. We have to make sure that you have all the appropriate vaccinations and background screenings and a sponsor and everything, but we can let that happen. But say that you graduate in May and that, we've already filled ours up, and we have. So what would I do? Number one, it depends on what you want to do, right? Do you just want to work in the emergency department, or do you want to be a pediatric emergency department? My suggestion to you is, if you want to be with pediatrics, then find a job somewhere in Brenner Children's or Levine Children's. That is our sister hospital. And you go there and start in their inpatient area. Pediatric Intensive Care Unit, the PICU, that is the unit that our Director of Nursing sponsors. And of late, we've worked together very collaboratively, and they see very critically ill patients, and we send critically ill patients to them. So that can give you some skill sets that you may need. A lot of people are very interested in our NICU. We have an amazing nurse manager, Lacey Fallon. She is their nurse manager, and she is an up-and-coming student herself. Not only has she recently graduated with her master's degree, but she's working on her doctorate degree, and she's consistently trying to improve that unit. You know, a couple of years ago, they had more than 3/4 of their department were travelers, and now they have hardly any. So if you don't see the information that you need here in order to get onto the PDD, or you want to explore other opportunities, reach out to us as well. We also are very collaborative with them and can assist you. But if you want to be a peds nurse, start with pediatrics. Don't go into the adult world. It's very different. But if you have a thought of, do I want to do peds? Do I want to do adult? Then start an adult. I worked in the adult emergency department for the first half of my emergency nurse career and loved doing it. Adults are very different than pediatrics. We are not just, taking care of little adults, we're taking care of children, but the adult population is very diverse, and you'll learn a lot of different things about them. And the skill set in any emergency department puts you ahead of the game. But just think about what you want to do, talk to your mentors, maybe shadow some different people. And we're actually happy to help and assist with that as well. So just reach out, but just don't give up. There's always opportunities. People come and go in the pediatric emergency department. We are the stomping ground for a lot of different things. We've had trained a lot of leaders. We've also trained a lot of nurse practitioners. So it's a great place to be, and there's usually an opportunity if you're willing to wait just a little bit.
Julia, I answered your question in the chat. So just let y'all know as well, we are currently transitioning systems with our tracking system. So we'll be operational probably around July. So as everybody gets caught up with trainings and whatnot, and we start posting positions, we'll definitely have that new cohort for February come out probably around I would say end of summer, fallish. So just keep an eye out for that application. It should say RN residency in it, and it'll have pediatric. And then I'll also include like February on there. So like when new grads apply, they know it's for that December graduation folks. And then, yeah, there's my contact information. If you want to keep in touch, send me a follow-up email. And I'll definitely, once things gets posted, I can also send it to you via email, direct link to the posting. And then also too, I'd also like Michelle said, if you get a shadow opportunity and get to do that, I always recommend to everybody, if you're able to do that because we rather have you see the perception of reality than go in blindfolded, because if you know what you're getting into, it's a better way to go in than to not know what you're getting into. So definitely would encourage that as well as an option.
I would also say, is there anything that you would like to know about the emergency department that we didn't cover? We're happy to answer questions about the actual emergency department.
Okay, let's check the chat. Is LinkedIn the best way to message and coordinate shadowing opportunity, or would email be better? I would say email will be better, right, Michelle? Yeah.
Email, yeah.
Yep. I would say LinkedIn. If you give us a follow, just follow us, because we're kicking off that initiative to show them in a perception standpoint to all the things that they're doing, and just show people like, hey, here's what we do in the PZD to celebrate teammates. Here's what we do, for our working environment to make it an awesome place. So also too, another thing like security. I mean, security is a big thing with emergency departments, and they really do a great job of making sure y'all's safety is, number one priority, and also the patients. So they really emphasize that in our PEDS and our new adult ED that's going to be opened up. So that's another great reason why is with everything going on in the world currently, we try to make it the best safe place as possible for you to work and give you your best skills. And I'll let Michelle, speak more to that.
Yeah, I'm actually very proud to tell everyone, and I say it to everybody I know, that we have a metal detector in the pediatric emergency department prior to entering. Now, our patients generally, if they come through EMS, they come on a stretcher, and what we do is have the patients come in and their parents go through the metal detector to get them registered and checked in. We also have security that mans that station. So there's always a security guard at the metal detector. Additionally, we have a security officer that is stationed in the pediatric emergency department 24/7. We have what's called spot badges, and this is an alarm system. And if you feel like that you are in distress, you can push the button on the spot badge, the red button. And not only does that alert security at our main station, but it also sends out an alarm over every single provider, nurse, nursing assistant, and security officer in the pediatric emergency department with an alarm letting somebody know that Michelle Daniels is in distress. We also have created a localized alarm system. It's kind of a little button that you push, and very happy to tell you that we have an entire organization-wide initiative headed by one of our former, I guess, and current emergency medicine attendings, Dr. Jason Stapira, working very hard to make sure that all of our staff members are safety, because we read the news too, and we don't want anybody to get injured or hurt.
Thanks for that, Michelle. Let's see. Okay, Kaylin was wondering, how could I sign up to shadow the unit so I could apply with the next cohort and know what to expect a day in life in the pediatric ER?
If you want to send me an email, I can get you set up with the steps that you need to take to be able to like get the sponsorship and approval. And then we can set up a date for you to come in and shadow. So email me is probably the best thing to do.
Yeah.
Let me put my email in this chat box too, so everybody has it.
Oh, Julia's typing. Sorry, guys. I'm just waiting to see what she says. As you can tell, she's typing. Also, I'll just do a little plug. So for those who are gonna review this online on our YouTube channel, please like, subscribe, please give us a follow, and if you have any questions for us, that view this video, please reach out. All the information's there. Take the time and see what we do, what they do great here in the PZD, and hopefully we'll see it down the road. So here's Julia. She works as a PST on a pediatric floor right now. What other things would be good experience aside from shadowing when applying to the job?
So Julia, I'll tell you, that is actually an exceptional way to go about it. Remaining, I assume a PST is kind of sort of like a nursing assistant or tech. Okay, yeah. So that is an exceptional experience. When we look at resumes, one of the first things that we look for is, do they have any experience in emergency departments? Do you have any experience with pediatric patients? And are you currently working? I don't expect you to work a 40-hour week. You're in school, but to get some experience and to gain that awareness, and just do well in school. Please, please, please do not stress yourself. You have plenty of time to work. get experience, do the job, but also take time for you, right? Learn to take care of yourself early on, have that good school life, work life balance, and just come prepared when you do your interviews. Make sure that your resume looks really good. Make sure you're real sharp and articulate, and write down your questions when you come for an interview that you want to know about. We love to answer questions, and we're excited when you have them for us.
Speaking of questions, you know, when you do start your nursing career, I've experienced a lot of new grads having trouble asking questions during their orientation period. So that's like a huge recommendation to get involved. Especially this leadership team, as you can tell, they're hands-on, they're involved on the floor, they're, you know, in the weeds with you. Ask some questions. We all emphasize help. Like, we want to help you regardless of what you want to do in life, and we'll get you there. You just have to give us a little bit something back of, you know, showing you want show up for work every day, have a, you know, good attitude. Not every day is going to be, you know, sunshine and rainbows, but, you know, this is an environment where you can grow, and your managers got your back in every which way. And, you know, it's a great team to be a part of. And as you can tell, all of that stuff they just put together and talked about, it's a great, you know, team atmosphere that I definitely would work for, you know, if I was an RN. So I definitely applaud all the great things that they do, because they also take care of our future, right? Our kids are our future, and they do a great job. I'll take my kids there anytime. I'm sure I'll get a hard time about it, but at the same time, I know they'll get the best care that they'll have. So really appreciate what this team does on a day-to-day basis. So if no more questions, I'd like to thank Madison and the marketing team for putting this together. I like, you know, Kelsey Becker and her team, and Michelle for, you know, speaking tonight and putting together those great slides. And thanks for all who attended. Thanks for all who's going to view this, and thanks for all that's going to apply and, you know, come down to the PZD. You know, if you want to shadow, get to know us, please follow us on LinkedIn, see the up-to-date things that we're doing, and then we'll look forward to seeing you next time. So thank you all for tonight, and we'll see you again.